Quality of life is of utmost importance with this disease. Patients have a multitude of symptoms when they come into the clinic for the first time. They may have diarrhea and flushing or wheezing and weight loss and abdominal pain and really a miserable life for a number of years. And when I see these patients, again, my goal is to try to improve that quality of life. And I often tell my patients, this is going to be a journey, and we've got several different tools that may potentially work for your particular cancer. And we're going to try these and exhaust these and see what works and see what doesn't work. And I often say, if I'm giving you a drug that I think is going to work for your cancer, and it is putting you in bed all day and making you miserable, that's the wrong drug for you. We're focused on a disease that I'm not going to cure. This is quality of life is one of the most important things we look for. The neuroendocrine patients come to us from all over the country. They tend to be very well educated, and when I first started doing neuroendocrine cancers several years back, many times patients knew more than I did about their cancer, and they're very good at picking up clues from other patients and saying, oh, maybe I should ask my doctor about this, and maybe I need to be on this particular drug, or this clinical trial is coming down the road. Do you have this? Do you have this particular treatment? And with the internet, there's lots and lots of different support groups out there. And so patients come to us with their questions that they've heard online, and they say, well, am I a candidate for this? Or what do you think about this? And many times these are very good questions that we say, oh, well, yeah, maybe you are a candidate for this, and I'm going to send you here to have this done. And it's good that patients are able to do that, and patients are able to connect. And we see patients from all over the country. So we work with the local oncologist to help facilitate that particular care. So when a patient comes to New Orleans and they live in Nebraska, for instance, there may not be a neuroendocrine expert at that particular site, and that's okay, because we can provide them a roadmap of care and to send back to the local oncologists, and we're open to phone calls and emails and all of these things that go along with that long distance relationship. Need to really become their own best advocate. You'll hear stories about misdiagnosis for years and years. You'll hear and I hear this every day. Patients misdiagnosed, patients put on the wrong treatment, patients told they only have a few weeks to live, and they come to me and I say, well, I've got to try to backpedal and say, well, actually, this is what you have, and this is what we expect to happen, and hopefully you don't have just 2 weeks to live. And I think if they have 2 years or 20 years, I can say, yeah, this is something that you're going to die with rather than from.